Yeah.
Now you can welcome all. Next, Surendra
Yeah.
sir will take the class.
Okay. So good evening, everybody. I'm welcoming all for our today's evening's program, and our Surendra sir will take forward the class, and after that, Murthy sir, and then I'll continue the session. I'll be talking on fevers today, and just the basic information about fevers and our normal approach and homeopathic methods also. I have not specified COVID in this because COVID we have already addressed once, and the present one is not a major one to worry. So we will next session I will add that session once again with a new variations if people are interested. Thank you very much. Our Surendra sir, please carry on.
Thank you, thank you. Good evening, everybody. Welcome all the elite members for the evening enlightened program. Of course, we are spending our time usefully and effectively for not only for our maintenance, but also our own kith and kin and our own relatives.
Yeah, I
Advise
request.
them.
Sorry, sir.
Because
I request all,
everyone,
one second, sir. Sorry, I request all to keep your mics mute. Balasubramanian sir, your mic is on. Yes.
because everyone cannot go to doctor every time and dime, because you may get many doubts. So we can enlighten them, we can them help them, assist them, unless we equip ourselves with that. All right. Today, I want to take about diet and regimen. Previously, this was not a subject even in allopathy. Now, everywhere, worldwide, the diet has become important. In spite of the fact there are obnoxious advertisements of junk foods, even the Western countries now feel that about this, but they got no other go because their habitual eating is only that. Habitual eating is only. Whereas India, being born in a divinity, being fed upon good habits and culture, due to ages, we have been advised about a diet, good diet, sadhvika food. Of course, you can touch the non-vegetarian food occasionally. It is not a regular. But when culture has changed, people begin to go to the junk foods and also this non-vegetarian stuffs. You see in advertisements in China and other world, they advertise lot of animal food. All right, we are not concerned. Let us know about diet. A regular nourishment for maintaining the orderly system of the body, according to the requirements of the body. So what is the requirement, sir? How do we that's why it has been jotted down, tabulated, advised. Immediately after getting up, you take hot cup of milk. Of course, that milk is replaced by coffee or tea. After 8:30 or 9:30, you take breakfast. Breakfast must be a solid one, but that has been changed. They go to some fruits, that Kellogg and other things, they put in the milk and take juice and rush to the office. In the afternoon, we get a lunch. It's a solid food. It's a combination of all the nutrients. And in the night, we take dinner, which is very light. That is our orderly food that we are doing. Because this is the answer to the question, to the requirement of the body. Hospital diets are usually graded as full or ordinary diet, light or convalescent diet, especially nutritive and easily digestible food with good calories. Fluid or milk, which is means only milk only, mostly only milk. This is extreme stage where your entire digestive system is in the range where you have no other go. But we know instead of milk we suggest buttermilk. It should not be thick. What we call it a lassi. We should not be like that. It will be very, very thin. Very, very thin. So it is easily digested. It cures the system very beautifully. Okay. And includes other fluids and fruits. Special diets usually consist of reduction of more and more food factors, increased quantities of food according to the contingency and according to the person's habits. Because somebody is a voracious eater, he'll put this left hand and right hand and take everything. Yes, that's it. And for diabetic also, there's a regulated diet. A diet of 4,000 calories daily for those with underweight. Low calories diet. A diet reduces 1,000 calories daily for weight reduction. Line of ration is a diabetic diet. That is, here, whatever you take, it is converted into amino acids and is stored in the liver. And it is supplied to the body whenever it is required by the body organ. This, how it requires it, how the message is sent to nerves. So medulla oblongata controls this. So this phenomenon works beautifully. Supposing you want to run, you prepare for a run, your mind sends signals, send him more energy, so that you run faster. You will not become dehydrated or spoon. So this is how this body mechanism is regulated. Used in all cases where there has been much protein or loss or excess breakdown and severe burns. So it all depends upon your disease, morbidity in the matter, either burning or the injury, etc. as the case may be. One contains much roughage for the treatment of constipation. Low residues, that is, we suggest you take fruits and you take bio number 4, you take bryonia because dryness prevails there, fluids are lacking there, etc. etc. One which is restricted fiber or roughage content suitable for inflammation of operations on the intestinal tract and low salt diets may consist of table of salt, salt free cooking, and regions of special low salt diets, etc. etc. This is where, when low sugar is there, you add sugar. When low salt is there, you reduce, you add salt, or when there is excess salt, you reduce salt. Generally, there won't be low salt, rare cases. Most of the cases will be high salt variety. Or all damages. Damages caused due to rupture, injury, etc., where the tissues and other things have to be replaced. So protein is required, etc. This is all which refers to the concept of diet. Concept of diet. I am going to how to regulate the body diets. What are the homeopathic case of diet and regimen? Yes. There, Hahnemann has vividly described Hahnemann has beautifully described this concept by saying that one has to be very careful with his diet and regimen. That is 300 years back. That has been written, stated. What he says? Problems of diet and lifestyle especially are chronically ill people because of their problems are aggravated by errors in their regimen, and he addresses some of these concerns. Here, I just switch over to 5 degrees left or right. Vata, Pitta, Kapha. Hindu philosophy. It also says same thing. Says same thing. If this is deficient, this causes. If that is deficient, this causes. If that is deficient, this causes. But here he says that after consumption, after your habitats, you get defects and you become problematic. Here the diet and regimen becomes important. That is an afterthought. Whereas others is fully controlled one, precautionary one. I am not praising. You see the prodigy of the Rishis and Mahamunis philosophy of the Hindu therapy and other things. It's a beautifully meticulated and calculated system. Yes. What he says, prolonged deprivation of things necessary to the life, that is, unhealthy places, especially swampy regions, etc. Second one. The third one is dwelling only in cellular, or that is without air and light, damp workers and other closed quarters, lack of exercise or fresh air, modern youth's addiction to computer games, etc., etc. That is 200 back years, computers have been mentioned by Hahnemann. Physical or mental overexertion, continuing emotional stress and chaos. These are all the contributing factors for the disturbance in the body organs, and how you have to manipulate them, correct them, is the concept. He further wrote lifestyle, hygiene, environmental influences in his beautiful lectures, where the friend of health, lesser writings, they prominently exposed this diet and regimen. We must remember Hahnemann had to be very strict while he was testing the patient, continuously changing his new art as to not allow dietary factors interfere the effect of remedies. That is, he examines the patient, prescribes the medicine. His medicine should not disturb the functioning of the diet, nor the diet should not cross over the medicine. See how meticulously he calculates. I am not saying this. He said that. See, we must remember Hahnemann had to be very strict with his testing, improving and controlling, changing his new art, that is, he himself changes according to contingencies, not allowing dietary factors to interfere with the effect of remedies in the fortune of process of cure. This he has described in Aphorism 259. Then, often or later, Hahnemann found the patient does not abstain from taking coffee. Our coffee and the Western coffee is entirely different. We all know they take pure coffee and pure black coffee or chocolate mixed coffee like that, and pure tea, black tea. They only like that because they are accustomed to drinks. So they want that same standard to be maintained. Those who are not abstained from coffee and spirits, that is effervescence, improvement was not at all noted. A great deal of depends on the patient's idiocracy, that is cooperation. In chronic cases, several situations where coffee has antidoted remedy, especially a chronic case, great success, where he has given antidote medicine to the coffee, restricted the patient not to take coffee, then go with some regular diet, soft diet, according to the condition. Then he found that prognosis is very gradually improved. Then it is been the best to refrain from using coffee because it is unhealthy and can be considered as a drug. But here, stopping for a moment, I also told you about our experience in the clinic. If you say stop coffee, they'll stop taking homeopathic. So, we have to be alternative then. We have to be alternative. We have to give high potency. Because what we take coffee in India is not at all a coffee. The action of the caffeine is diluted in the milk or in the tea. So, we can take higher potency of the drug according to the contingencies and regulate. So, that aspect is over. Coffee. So, now you all can come to homeopathy. Yes, then comes the recent problems. He only explains about how has to be manipulated with the diet and regimen. Nutrients are the main thing. As already said, there are 3 stages for the cure, where you can take your regular diet if for disease aspects doesn't interfere with the medicinal force as well as your disease condition. That's one thing. Second aspect is, we have got a lot of problems in. So, the patient himself says about some aggravations of some food. So, but he says, I am very craving for that food. So, we have to arrange those conditions according to the contingencies by asking them, avoid it for some time so that we can continue it after some. Till then, we have to give some prophylactics for him to have the craving being removed. Then comes the homeopathic medicines act. What are they? Supposing stomach ache, supposing lungs disturbance, supposing urinary disturbance, you have to regulate the diet according to the functioning activities and the disturbing factors in that functioning activity. That's how you can overcome the problem. Supposing he has got a craving for alcohol, you have to give antidote medicine for alcohol, you have to give him some nutrient foods, and you also regulate the condition with homeopathic medicine with higher potency. The craving medicine, antidoting the craving medicine, that you give slowly removes it. But you see, it is very difficult. It is very easy to say that I give medicine in homeopathy or another system. See, they've been helping the chronic drinkers in the homes with antidote medicine, strictly advising them not to take social drinks after that. 15 to 1 month back, after the recovery, with his friends' encouragement, goes again. Once he goes in, again it is doomed. Damage has begun to take place. What are the little recovery that is not get gone? So, diet and regimen is very, very important, particularly. Sir, all right, sir, leave it, Guru. What about my food digestion? Dysentery is there, diarrhea is there, chronic diarrhea is there, chronic dysentery. Yes. With medicine we can contain, but with food also a help must be there from the patient. He cannot take biryani. He cannot take protein substances. He cannot take hot substances. So he must cooperate. See, in most chronic ulcers, when they are admitted in the hospital, your food is completely stopped, only you go by drips for 3 to 4 days. That is what naturopathy says. When you go to naturopathy dispensary, hospital for treatment, your food habits are completely changed. They do only juices. They go only fruits in the lunch. Again they give some little solid liquid foods in the night. But they regulate it with all the required nutrients. So I've seen from my office days that many of the engineers were sent to Bangalore for this naturopathic treatment. They all returned, and that branch was started in Tamil Nadu, Chennai also. They continuing there, and they all felt very agile, happy. But after coming back, after a month or so, gone to the regular diet, regular habits. So, that's why they say in Tamil, Vaya Kattanam, you must restrict your tongue, not in speech, in your intake also. That's how you control your diet and other hashtags. Without controlling diet and regimen in a chronic or acute condition, you cannot completely overcome your problem. Particularly where the organs are affected. When the mental derangement is there, some separate foods are prescribed, and they are under the constant medication and observation. When the body pain and other things are there, you take extra nutrients along with homeopathic medicine. When stomach upsets are there, you take medicines accordingly. We have already described about what are all the medicines from, mostly you have to use from mouth to anus. These are all not for the name's sake. They are for your health. Particularly, see what happened. Up to 6 years, when you are in the office and other, when your activities are more, you take some other diets here and there and go. So after coming stationary to the house, you restrict yourself, your movement, mobility. Here the problem starts. What happens? Your digestion becomes very, very low because there is no activity. That is why we said, even though you are 70 years or 80 years, whether you are American president or Indian president, you must walk. In other words, you must give exercise to whole of your organs in the body. This is also one way of regimen. So with all these things, I conclude this small topic. You must be careful when you know that you cannot take more hot substances, chilly substances, avoid them. The leading Apollo gastroenterologist on other day in Sun TV was describing that after 65 or 70, when your stomach doesn't agree for some foods, avoid them totally. How much craving you for that? Avoid them totally. Take it a little, but don't take it regular. So you must not disturb your body organs when they become older and older. You have to go make them older and older. Okay. Thank you very much.
Thank you, sir. Murthy sir?
Is my voice audible?
Yes, sir.
Okay. Namaste, my dear homeopaths. Last week we have taken pregnancy. This week I want to take amenorrhea. Amenorrhea. AMENORRHOEA. Amenorrhea means absence of monthly menstrual periods. Absence of monthly menstrual periods. It is otherwise called as amenorrhea. The absence be due to so many factors and diseases also. For example, at the menopause, absence of menses will be there. In pregnancy, absence of menses will be there. And when the person is using any birth control medicines, absence of menstrual period will be there. And sometimes over medication to the body. For everything, they will go to pharmacy and they will ask something and they will eat some medicines. Because of that one also, amenorrhea will happen. And sometimes delayed puberty. At the age of 12 to 14, generally puberty period. If suppose it has gone to 16, 17, 18, at that time also absence of menses will be there. And finally, nowadays, everybody is facing because of the stress. Whether it is stress is totally acquired. we can easily stop that one stress. But people are very stressed. So this amenorrhea can be divided into two. One is primary amenorrhea, second one is secondary amenorrhea. Primary amenorrhea means pathological amenorrhea where menstrual function is delayed up to 16th year or 17th or 18th year because of general systematic disturbances like tuberculosis, diabetes, severe infection, anemia. Some young girls, they will have cardiac problems also. Because of that one, absence of menses up to 16, 17, 18 years will be there. The secondary is pathological amenorrhea, defective development of uterus. That is a major one. And excessive fibroids will be there. And nowadays, PCOD is also there. Polycystic ovary syndrome or polycystic ovary disease. So for this, in homeopathy, we are having good medicines. Basically, the first and fundamental is Pulsatilla. It is the first remedy when menses do not appear. If you give 3 days or 4 days Pulsatilla twice a day in 30 potency, naturally it will come. Or sometimes system is frequently it is coming, means you can give Pulsatilla mother tincture also. And moreover, when you are giving mother tincture Pulsatilla, you must be very thoroughly verify that whether they are having polycystic ovaries or any uterus problems. You ask the concerned person to bring the pathological reports what they are having. So without that one, you don't give mother tincture. In 30 potency or 200 potency, it will work excellently. The menstrual flow starts and stops, starts again, stops. At that time, flips will be there. At that time, these Pulsatilla will work excellently. And they will keep everything into their mind, and all negative thoughts will be in the mind. At that time, Pulsatilla will work excellently. And another thing is constitutional remedy, Calcarea carp. If the person is very bulky and chubby and having when they were walking or doing some little work also, they are getting some breathing problems. At that time, you can give Calcarea carp. By seeing itself, you can select this remedy. Patient is flat, fair and flabby. Generally, these periods, first menses are that will appear and go. Again, second mens also appear and go. At that time also, Calcarea carp will work. The third one is graphitis, one of the best remedy. Generally, above 24, 25 years people, they will have graphitis is one of the best remedy. Scanty menses and dark flow will be there. For they will cry always, they will weep always for small things, small troubles also. They will think some disease is entered into their body, their health is deteriorating. Like at that time you can give. And moreoverly, graphitis, when you select this remedy, they will have skin troubles. Rough and dry skin will be there. And sometimes constipation, not total constipation, constipated stools. It will come little like the dung. And hence the menstrual flow in the graphitis is very pale, too scanty and too late. Sometimes it will come 33 days, actually 28 to 32 days the period starts depending upon the constitution. If it comes 35 days, sometimes 40 days, sometimes 32 days, sometimes 30, in like this it is jumping few days, means graphitis is one of the best remedy. But preferably you see any skin symptoms are there, then graphitis selection is very good. When any chill is there, you are going out and coming in the night, when chill attacks, at that time if menses are stopped 2 or 3 days, aconite itself will come. And when suppression and delay of menses due to debility or anemia is there, you can give Ferromet, one of the best remedy, Ferromet. You can give Ferromet. And Cyclamen, suppressor menses by wetting feet. Is the persons who are working in watery, in kitchen, when water is there in the ground, for those people we are having Pulsatilla also work, but better medicine is Cyclamen. and subal cellulita, delayed menses, and some uterine disease are there. Flat chest will be there. When you are selecting subal cellulita, you must see that undeveloped or underdeveloped chest will be there. Then only you have to venture the subal cellulita, otherwise don't give. Sepia, first menses are delayed, and the leukorrhea along with menses will be there. When sepia selection is there, you must be very careful. Congestion of blood will be there. Severe hysteric headache will be there, just like Natrambo. Severe hysteric headache will be there. Headache, toothache, body ache, everything will be there. Yellow spots are there on the face and any skin, wherever you are seeing the skin, there yellow spots will be there. A yellow complexion is also will be there. At that time, sepia is one of the best remedy. And lycopodium, sometimes it will work when menses are suppressed by fright and fear. Sore vomiting will be there. Swelling of feet, leukorrhea will be there along with menses. And these are the medicines. And bio number 15 is also one of the best remedy, along with whatever you are selecting homeopathy medicines you can give. And the other chapters comes, I will tell. Here the Fraxinus americana will play a major role, and this Alatris ferruinosa also will play a major role. So at that appropriate time I will tell. With this my lecture is over. I will ask Anup Kumar to take. Okay, thank you, sir.
Thank you very much, sir.
Sendil పంపించాడు. கொஞ்சம் பெல் அடிச்சு வெயிட் பண்ணுங்க. சரி. அவர் செந்தில் நான் பேசணும். சாமி சொல்லுங்க.
So, welcome to my discussion. Today we'll talk about fevers. It's nothing which is new to everybody. Everybody knows fever.
Okay.
And I'm just taking you all through the discussion just to, focus on the point, what is fever and why it is happening. So just we'll ask, what is fever? When we have an illness or infection in our body, the temperature may rise above the normal range. That everybody knows. When we have some infection in the body, the temperature will rise to the normal range. This is called fever. Fever could help our body to fight back the cause which is making the fever. That means sometimes some infection will be there inside the body, and when the temperature is rising, the body will be able to fight the pathogen what is attacking the system. It may make us feel hot and discomfort will be there. Body will have too much pains and all, but that is how it is. But the benefit is much. If an adult has a fever, one may not need to see a doctor because adult's body weight is big, and he'll be able to withstand the problems, up and down, the fluctuations will not make him bad into a serious condition. But if it's a child having fever, the body weight is very small, for 3 to 5 kilos only, and maybe infants are lesser than that. So when they have fever, we have to seek medical help immediately because something can go wrong, and we'll have to, there will be no comeback. So fever for infants and children have to be attended to. Fevers may be high body temperature of more than 101 degrees Fahrenheit, and either it is a continuous or intermittent lasting for 3 weeks. It may be we have high body temperature of 101 degrees Fahrenheit with unknown cause. Even after extensive diagnosis, we will not be able to find the cause. That is how certain fevers are. So, people will be watching the thermometer and seeing and trouble all the time, but the cause will not be found. So normal body temperature, we'll know, when we were small and school and all, we know our body temperature, we were told it is something in the range of 98.4 or 98.6, and we had been, anything more than 98.6 or something like that, we'll be panicking because our fever is the body has fever. But now the present study, after many researches and all, what they found is this 98.6 business is all not right. This temperature was made standardized for people of the 19th century, that is in the 1800s range. So that is the time when they standardize the issue, and we were still reading the same issue. But actually, the average temperature of the present day normal person is much cooler than the 19th century people, because the lifestyle has changed. We have been more sedentary people, no exercises, and our general habit is more of indoors, and no much of outdoor activities and all, less exercise, more sitting, more brain work. So the temperature has come down from 98.6 to something in the range of 97, it's lesser by one temperature. So this is normal, and it can be between 99 also, little here and there. So the 98.6 is not the correct standard nowadays. So lesser than that is the standard. So 97 is the standard now. Our body temperature changes through the day. We all know, when the daytime morning, we'll have the normal temperature, which is because we are in the bed, and the night it will be the cold. Outside weather is cold, so the body temperature also will not be very high. Warmest will be in the evening, because after our day-to-day activities, our muscles will be generating little energy, heat, and our body temperature can rise. So we may be warmer after doing some exercise also. So 97 is the normal temperature these days. So now we'll talk about fevers. It's a low-grade fever. If the temperature is higher than the normal but lower than 100.4, it's called low-grade fever. So when people say you have a low-grade fever, it is within the 100 or little above 100. 100.4 is called low-grade fever. All mild illness like cold or any earache or ear infection or any other infection may cause these sort of low-grade fever. Some people may have low-grade fever after vaccination. Some activities going on inside, some fight between the intruder and the our immune system, temperature raises, and that is how when you introduce some foreign bodies inside by vaccination, then there will be low-grade fever. If this fever doesn't come back in a few days, then we may have to discuss with the doctor. Otherwise, after the first days of vaccination, the temperature will go high and come down. So nothing, if it is not going down, then we have to worry. So how does fever affect our body? If we have fever, we may feel hot, and when the temperature comes down, we will feel sweaty. This is normal. So when there is fever, the sweat glands won't work, and when the temperature cools down, the body starts sweating, and the sweat glands work. So that is the normal type of fever what we all experience. We also might shiver because we will feel chilled inside. When because of the fever, there will be chill inside, and we will be shivering. So that is, shivering is also a method of generating heat. The muscles will start shaking, and the muscle fibers will be moving vigorously, and the heat is generated too. So chill and shiver is interconnected, and when we have fever, we may shiver. Overall, we'll have tiredness, the weakness of our with body aches, or fatigue could be there. Like we will feel tired also. We may also have symptoms of base illness that cause the fever. That is base illness, I have told you, infection somewhere, or some wound or injury, something like that, and that area is getting infected. So we'll have symptoms of that infection. Sometimes cold or cough will be there, sore throat will be there. So that throat pain also will be there along with the fever. Food may not taste good, because we know when we have fever, we don't have appetite. The food may not taste good. The reason is our taste buds won't work, our enzymes won't secrete properly, so digestion will not work, or so we'll not feel having the appetite. We may have bad mood towards everything. Anybody comes and cracks jokes also, we will not be feeling like laughing, because our system will not be normal. So we will be having a bad mood. For children, the fevers may be a bit more severe. For adults, I told you, we will be able to manage. But children, their fever may be a little more severe. Some children may have something called febrile seizure. Febrile seizure is called fits in our normal parlance. The children may have fever, the seizures because of fever. And what happens is when the body temperature rises, brain also will not be able to function properly, and when the brain's temperature is rising, it will trigger these sort of seizures, which is normal for kids, but it is not essential, and it has to be avoided. So how to avoid it? So this is the picture about a sweaty person after fever. You can see all the dress will be soaked and sweaty. So what is febrile seizure? Up to 4% of children of ages 6 to 5 years may have seizures with high fever. So children with high fever of this age group may have febrile seizure. The symptom is their eyes will roll back. We'll see the white part of the eyes only. The iris will be behind the top eyelid. The eyes will be rolling back. They may seem to faint. They will not be in senses. Their body will become stiff, muscles are all stiff, and electric reaction. Body will be stiff and bending backwards or forwards, whichever position they are. Shaking and twitching are possible too. But it's a difficult situation to see a person going through a fit. It will be like a not very happy situation. We'll feel really sorry and can't do anything much about it. We have to wait for it to come to normal. This normally stops in a minute. Doctors consider febrile seizure as harmless. It's considered as harmless because it's a brain-stimulated muscular reaction all over the body. So it is normally harmless, they say. But to be safe, we have to inform this to the pediatrician, the doctor, as soon as we notice that, so that in case anything is there, they can tell us how to go out with in case for future recurring seizures. So you can see the baby will be stiff, like some doing some yoga exercises backwards, and all rolling and stiff, and the mouth will be different. They'll bite the teeth, and this is the picture of a chronic febrile seizure. Yeah. So why do we get fever? Fever is a part of our defense mechanism, that we already discussed. Our body may rise its temperature to help to fight an infection. So when there is infection and there is a parasitic attack, some fungus, some bacteria, some virus attacks the body and we get infection, then the body mechanisms, in defense mechanism, notices that there is some intruder there, and the intruders also work in our same body temperature. So when we raise the body temperature, these intruders cannot function properly, and that is why we get fever. So this is a very welcome symptom for viral attack or any sort of parasitic attack in our system. So our organs also, all our organs also function at normal body temperature only. So when the body temperature rises, our enzymes won't work properly. The system will not work properly. As I told you, sweat glands won't work properly. The secretions won't work properly. So we'll also be suffering with the problem. But when our system is a little more bigger than the organs or the body of including attacking parasites, so they will suffer more than us, and we can postpone our activities for a day or two and still come back to normal. But the bacteria, virus, or the fungus what is attacking us inside will not be able to function in our system when the temperature is very high, and so it is better to keep watching the fever, not to bring it down immediately. So that is why we don't have, when the system is not working properly, we don't have taste of food, we don't have hunger, we feel tired even while walking. Our muscles won't be having energy. The energy conversion to glucose and for fuel for muscles will not work. So everything will go slow, and we'll be tired literally. And fever triggers our immune system to make more white blood corpuscles to fight the intruders. So that will be there. The fighting will happen all over the system wherever it is. Fever may help us to protect. Fever will help us to protect us from, even if it makes us feel worse for a little while. It is actually a protective mechanism to fight the intruders inside our system. We have to only be careful about cooling the brain by putting a wet cloth. I will be discussing that. How to check the thermometer? How to check the temperature? Thermometers is a measure of our temperature. Thermometers always, we have been using it for measuring the temperature. It can be checked by putting it in the mouth or ear or armpit, forehead, or in rectum, as the case may be. For kids, for older kids and adults, like kids above, for 5 or 6 years, like that, and who will listen to us while we instruct them. And for adults, most accurate method is to take the temperature from in the mouth using the thermometer with an oral digital thermometer. Oral thermometer is what we have been always seeing. So rectal is best for babies and for small children who will not understand our controls. So they may bite and the mercury can go into the mouth. So for them, the rectal testing, rectal and temperature is the best. To take temperature in the rectal area, what the doctors or the nurses will do is they'll apply some petroleum jelly on the tip of the thermometer and insert into the anus half an inch and into the rectum, and will be holding it there until the temperature rises to the maximum and won't fall down further. So that is how the rectal temperature is taken. So this is how we all have been doing our temperature taking in the oral checking, temperature checking. So when to consult a doctor? It depends upon the stage and the age of the patient. So for babies, when the fever is in the range of 100.4, little higher than 100, or even if it is higher than that, we should discuss with the pediatrician immediately so that they can find out if the fever is the sign of something more serious, or it's just another some cold or cough or something like that. So the doctor will be able to find out. We will have to keep the baby's brain cool, as I told you. Keeping a wet cloth on the forehead will avoid seizures. Just plain water can be dipped into a fabric, a towel can be dipped in plain water and kept on the forehead. You can even spray some alcohol. So even the sanitizers what we all use these days can be used. Olden days, eudiclone is dropped. A few drops of eudiclone will be dropped so that the water's surface tension comes down and the evaporating capacity of the water will increase when they add these sort of additives. Eudiclone or even a few sprays of sanitizer or 1 or 2 drops of alcohol or spirit in the water, and then you dip cloth and keep it on the forehead. The temperature comes down soon, and this can avoid a potential seizure because the temperature of the brain is brought down quickly. Other parts can be cooled also by methods I will discuss now. No matter if the temperature, if there's a fever is high or low, it's better to speak to a doctor if the seizure comes. Same way, the baby's temperature drops if it is dropping below than 97, the normal temperature, and it is remaining in lower than 97.7 or 97 or lesser than that. You should would mean that the baby's body is not functioning properly. The system is not working properly. His vital activities are not working properly. So we have to discuss that also to the doctor. The high temperature also has to be discussed. Low temperature also has to be discussed, because when the body temperature lowers, you can see the baby will become sluggish and cranky and all those things. So that is also something which we have to be careful for babies. So otherwise, you can see like an active baby will be cuddling onto mommy all the time. For children, seek medical help immediately if the child's fever is above 104. For little more bigger children we are talking about, and if the fever lasts for many days, several days. Also discuss if the temperature doesn't drop after giving the medicines for lowering the temperature, which is and if the fever is above 102 after the vaccine. If the normal vaccination, there will be a mild low-grade fever only. But if it is high to 102, then we have to talk to the doctor and keep a watch on the levels of temperature, whether it is coming down or more. No. Also, alert the doctor if the child seems to be too sleepy all the time. And if the child is not drinking properly water or liquids, and if he is not peeing properly for the amount of water he has taken in, then there is some issues and we have to be careful. And if the child has a febrile seizure for the first time, then also we have to tell the doctor if the seizure lasts for more than 5 minutes. Normally it's a minute's issue. The baby will come back to normalcy in a minute. If the seizure is retained for more than 5 minutes or so, it is immediately we have to rush to the medical emergency department, and it has to be attended to, because it is not a normal seizure. It is something which is not good. So children with fever, we have to keep monitoring. So for adults, the body temperature is more than 103 or higher, or if the fever lasts for 2 days and the number doesn't drop, the 103 is not dropping even after giving the medication or medication to lower it, the doctor has to be informed. Medical help has to be sought if the patient is not drinking enough fluids or is not going to the loo for urination. If he had vomited many times, if the patient has vomited many times and whatever he drinks is not remaining in the system, it's being puked out, then it is a condition which has to be attended to immediately. Visit the emergency department if the patient is having fever with a bad headache, has a stiff neck, or some new rashes or mental confusion is there, or if the fever is above 105, then there is no point in waiting and watching. We have to rush anyway. When a fever is there, always keep the brain cool by putting a wet cloth on the forehead. So this is how the wet cloth has to be kept wet, and you have to monitor your temperature so that you will be in a safe situation only, even if in fever. So should we bring down the fever? That's another question. If the patient is able to eat, sleep, and do things at home like reading or watching TV, and we need not worry need not bother about lowering the fever. If the patient is by and large normal, even the temperature is high, he is able to do everything. Then you need not worry about bringing the temperature down. Okay, forehead can be kept cold. Otherwise, don't worry, because the fever itself will be able to fight the illness. And a fever is made to with a raised temperature to fight the illness, and we should support it by not doing anything.
Sir, excuse me, are you putting any slide?
Sorry?
Are
Sorry?
you putting any slide supporting your thing?
Slide is there. No? Slide is not moving.
No, I'm not at all getting. That's why because nowadays sometimes you are telling this is how that's how, but
No,
I'm not getting the slide.
It's not changing, madam.
It's
being changed.
It is changing.
No, I'm not at all getting. Maybe I will check up from my end.
Yeah, it is your system.
Yes,
System issues.
Yeah.
Okay,
Okay,
sorry.
sir.
Sorry, so we'll
Sorry,
come back
sir.
to.
Thank you.
Yeah,
Thank
we'll
you.
come back. We'll come back to fever, whether it should be brought down. If the child is getting febrile seizures, suitable medicines has to be given to feel better. And but such medicines may not bring the seizures for future further seizures in future also. But it can bring down the conditions so that the patient will not suffer at that point. But further, when the fever comes, medicines will not the medicines which we had given earlier will not help to prevent the seizures. Okay, so
I'm
medicines.
getting, sir. Thank you, sir.
Yeah, welcome.
Thank
welcome.
you.
Yeah, yeah. So this patient, you can see even with the fever, she is able to do everything and read. So there is no need to bring the temperature down. Like that, we can also keep monitoring the fever. So how to bring the fever down? Over-the-counter medicines like paracetamol, acetaminophen. That's a generic name of the medicine, and ibuprofen. Ibuprofen is another medicine. Or both allopathic medicines, which may ease the fevers for adults and children older than 6 months or 6 months. We are used to this paracetamol, which is a painkiller basically, and too much of paracetamol is not good. It will affect our kidneys if it is not taken uncontrolled. So there is a norm for paracetamol also. So don't do self-medication with paracetamol. For patients, infant patients of 3 to 6 months old with low-grade fever, intake of fluids and good rest should do the trick. So for small kids up to 6 months, mother's milk and the other water, whatever normally we can give, is good enough to bring the temperature down. And for sponge baths and all those external methods is good enough to bring the fever down. But consult the pediatrician; they may give you some ideas how to handle the baby if baby becomes very irritable and uncontrollable and all. But normally, in a day or two, the kids normally recover because they have basic immunity from the mother's milk. Adults can use aspirin. Normally, aspirin is given for to ease out the situation, but never give it to children because for children it is having a detrimental effect. So I'll tell you why it is. Wearing light clothes may help because tight clothes can be suffocating and difficult. So we have to wear loose clothes. And when you have chill, it's better to use a light blanket and cover yourself, but not the head. Drinking cool liquids will bring the temperature down. because the temperature will be brought from down from inside also. The system will have cold system, and when the temperature rises to that level, the body temperature will come down. So lukewarm shower bath. A normal lukewarm shower bath will bring take away the heat out of the body, so that way you can bring the temperature down. Or sponge bath may also help the people to cool down when the temperature is too much and uncontrollable. All these things can be used to bring the temperature down if it is essential. Place a wet cotton cloth on the forehead, that is what we all discussed now, can help to bring the brain cooler, keep the brain cooler, helping a quick recovery, because when the brain is become like, brain is hot, then many functions will not work properly, and it is better to keep the brain cooler and avoid any seizure or any damage to the brain. So keeping a wet cloth and then giving a sponge bath to the baby will bring down armpits, groins, underarms, legs, and the palms and all can be wiped off with a cold sponge soaked in water, and the temperature comes down immediately. So this is how you bring the temperature down and keep the monitoring going on. So what is fever of unknown origin? This is another topic which everybody should know. Fever of unknown origin. A fever of unknown origin is a temperature that reaches 101 degrees Fahrenheit, or off and down up and down of that levels, at least for 3 weeks, with no known cause. No known cause. The cause is not there. There is no throat pain, there is no cold, there is no infection, but there is some reason the fever comes and goes. So this is called fever of unknown cause, unknown origin. We all know that fever is a symptom of another medical condition. So we all know that there is something going wrong, and that is why fever is there, but externally we don't feel it. So the doctor will have to do some tests to narrow down the cause and determine how to treat the underlying illness. So the doctor will have to study your condition. So ideally, the doctor may prefer not to give any medication while the fever remains undiagnosed. So normally what the doctor will do is they will be studying yourself without giving any medication. The fever will help to fight the infection by retarding the multiplication of the infecting pathogen. We already told how it is retarding, because the activity of the pathogen will be brought down when the temperature rises. So that and the doctor will be watching your progresses, and they will decide what to be done. Treating the fever without knowing the cause might reduce the body's ability to fight the possible infection. So that is why the doctor keeps you monitoring but not giving you medicines. However, doctor will prescribe drugs to reduce fever in children who may suffer febrile seizures caused by fever. So for them, they will do that. Doctor may prescribe fever reducing medicines if an adult patient has a heart or lung problem. When the heart or lung problem, adult patients have a fever, their demands of oxygen will be high. So when the fever goes and they are not able to do properly, then oxygen deprivation will be there, and that can lead to complications. So in that case also, doctor may give you some medication to bring the temperature down. Fever, what is the cause? Fever is a symptom of more than 200 conditions. In children, infection accounts to more than 50% of the fever and fever is of unknown origin. So 50% will be for children, it is unknown origin, while inflammatory and malignant diseases account to 5 to 10% only. So 50% will be of unknown origin. They will have some infection somewhere, we do not know, and it will have to take its time to heal, or we have to attend to that. In adults, infection only accounts for 16%. Because we are we are matured up, and the infections, they're not prone to much infections. So tumors and non-infectious inflammatory disease will be the next cause for adults, such as rheumatoid arthritis or something like that will be working from inside, and that can be the cause of adult fevers. However, in up to half of the adult cases, no cause is found. So again, in adult also, there will be unknown fevers, fever of unknown cause, unknown origin. Doctors will have to do a series of tests to narrow down the list of possible reasons of high temperature. They'll have to keep on studying it. So there are various causes, as we said, vaccination, overeating of the body. When you are subject to overheating, the body will also have fever, dehydration, rheumatoid arthritis, certain medications can cause fever, cancer, autoimmune disease, drug abuse, alcohol withdrawal. If you are on treatment, or if you are withdrawing as alcohol intake, the temperature can go high. viral infections, in sinus infection, chickenpox, malaria, pneumonia, urinary tract infection, gastroenteritis, that is stomach infections, skin infections, and sexually transmitted diseases can all be the cause of fever, and many other. I told you 200 conditions. So many things can be there. So what to expect from a doctor's clinic? When you go to a doctor's clinic, what will the doctor do? A service provider who's trying to diagnose the fever of unknown origin must look into various possible reasons to find the clue. Doctor may ask the patient a few questions which is related to his work, because sometimes workplace contains organisms that cause fever. Can be infectious, some damp areas and lack of air circulation, which are Dr. Surendra had spoken now, dampness and all. Those will be the cause of workplace disorders. Sometimes patients would have the patient would have visited different places recently. So locations where there are some local diseases and all, and he comes back to the place where there is no fever and he may have infection. So that will be one of the clue to ask. Locations can be overseas or even in certain areas in the country itself, where there is a lot of diseases, can be one of the questions asked. Patients' exposure to pets and other animals. If you have pets, animals, or if you have visited a zoo or any other friend's place where there is pet animals and all, that can be one of the causes. The patient's family history will also be asked, because there are hereditary fevers are also there, which is not much seen in our part. For example, familial Mediterranean fever. It's a fever, or it's an autoimmune inflammatory genetic disorder, genetic fever, that is affected in many people of Mediterranean origin. Luckily, we are not in that part of the area, so we don't have the genetically transmitted or genetically carried familial fevers is not there. So doctors will also examine the patient closely, paying particular attention to the skin. So skin will be observed, eyes will be observed, nails, the color of the nail, the texture of the nail, the coloring of the nail after pressing it, lymph nodes will be checked, heart will be examined, abdomen will be examined. So to know whether any sort of area is having pain or inflammation or water retention or edema or anything like that. Doctor will also take bloods and urine samples for testing. The patient may be guided to have an ultrasound, computed tomography, that is CT scan, magnetic resonance imaging, that is called MRI, and positron emission tomography, it's called PET scan. If the cause of the fever is still unknown, doctor may want to inject the patient with a labeled white blood cell. WBC will be, it's a isotope laden WBC will be injected into the blood cells. And that the WBC, normally the job of WBC, white blood corpuscle, is to go and fight. So this WBC will immediately travel to the location where the infection is, and once the injected WBC travels to the infected part of the body, the radioactivity which is already there on the WBC will allow the doctor to find out, when you take an X-ray, where the accumulation of this WBC will be there. That will be shown as highlighted area in the X-ray, and that organ specifically is infected or going through trouble. So the doctor can concentrate on that organ and treat the area or take samples of that organ or something. So that is how the unknown fever is identified. If the test shows no results, and doctor may want to do some minor surgery, like a small, needle aspiration, thick needle aspiration of the liver, or to take a sample, or even take a bone marrow sample to study the structure and of these tissues, which can be suspicious and not showing any results. So such biopsy also can be done. So this is how the WBC will travel through the blood and go to the infected spot. So there are different types of fever. So we have 5 main types of fever. That's called one is called intermittent fever. The temperature is high but falls to normal each day. So it will go high and fall down by the day, some time of the day. It will come down to normalcy. That's called intermittent fever. We have such a fever called malaria. Then remittent fever, it is this type of fever, the body temperature fluctuates but will not fall to the normal temperature of the body. It will be high and low, but it will not go to the body's normal temperature. This type of fever is associated with infectious disease such as infective endocarditis, rickettsia infections, brucellosis, and some other, and many a few among these sort of diseases which will cause remittent fever. Some infection is going on in the body, and the temperature will go up when the problem expresses, and it will come down, but not to the normal temperature, and the problem continues inside the system. So there is another fever called continuous fever. This is called a sustained fever. The fever is prolonged with a little or no change in temperature over the course of the day. So it will go high, it will be low, it will not go variant, it will be sustained. The temperature will be the same for the day. The temperature remains above normal throughout the course of 24 hours and does not fluctuate more than 1 degree in 24 hours. So it is almost a high temperature continuous. So this type of fever occurs in lobular pneumonia, when the lung lobes have pneumonia affection. In typhoid situation where the step ladder type of pattern, the temperature keeps on rising, and it will be remaining in a high plateau. That the graph will be on the higher plateau all the time. So that will be the typhoid type of fever, and also in urinary infection also, these sort of high temperature, the continuous fever can remain. So another fever is called hectic fever. This fever type, there is a wide swing of temperature. Intermittent fever or remittent fever is considered hectic, where with a temperature difference of at least 1.4 degrees centigrade Celsius between the highest and the lowest. So the temperature is high, but the variation can be 1.4 degrees here and there. So that is called hectic fever. This fever pattern is indicated as an abscess or a pyogenic infection. Some deep-seated boils called abscess is working, and pus formation is there, and that is infected. Pus formation will happen only when its infection is there, and this type of hectic fever will be there. This example of such thing is pyelonephritis. Pyelonephritis, it is the disease of the kidneys. Then relapsing fever, right, it will come again and again. This type of intermittent fever that comes up again and again after a few weeks or after a few days. It comes back again to normal temperature, but it will get fever again. With animal bites and disease like malaria, this is common. So some dog bite or some sort of insect bite or something like that, the disease will become normal, then it will come back again after 2 to 3 days. So it depends upon when the body fights and fails, then again it will show up again. It is like that. So it's called relapsing fever. So what are the treatment options? Doctor will advise the patient to take rest, drink plenty of water, fluids. Patient will be asked to stop taking other medications for ailments, so that that may not be should not be the cause of fever, because other medications also sometimes can stimulate fevers. If the patient has a heart or lung problem, or the case of child patients who has seizures as a result of fever, doctor will probably prescribe over-the-counter remedies to bring the temperature down for reasons we have already discussed above. So others will be told to just keep watching, taking a lot of water, not to take any much medicines. Doctor may prescribe acetaminophen, and aspirin and other non-steroidal anti-inflammatory drugs. Normally, it is advisable to avoid aspirin for children and teenagers. The reason is Reye's syndrome is a potentially fatal disease that causes numerous detrimental effect to many organs, especially to the brain and liver. So aspirin will cause Reye's syndrome for children, and their liver and brain can be damaged. Reye's syndrome is associated with aspirin consumption by children with a viral disease such as chickenpox, and if this is to be avoided. So in case of infection, the doctor may also prescribe antibiotics, like if there is a bacterial infection. For antifungal, if there is a fungal infection, and the viral infection, will be given antiviral drug, depending on the case of the infection. So medication. So next is nutrition, exercise, and supplements. So the food is the medicine. What Surendra sir told, food is the medicine. So we'll see how it works. The nutritional tips may help to improve the immunity. Eat antioxidant foods. So foods which will have antioxidant rich materials, such including colorful fruits like red and green and yellow type of fruits and vegetables are there. So they will have orange colored fruits and all are there. So they will have high levels of antioxidants, and that is very good for our immune system. Avoid refined foods like white breads, so that maida and all should be avoided. Pastas are made of maida, and so that is to be avoided. Breads are made, bread biscuits, everything is made of maida, so avoid that. Sugars will have to be avoided because they will trigger all the infections, so that has to be avoided. Avoid red meat because it will have high content of all the minerals, and red meat to be avoided. Have more lean meat like chicken or anything lean meat which is white in color. Fish meat is okay. Fish can be okay, had. Egg white can be had. Tofu is soya butter, soya paneer, we can say. Soya paneer is called tofu, and we can have a lot of proteins from the beans, cooked beans. All our grams can be cooked and had. So when we have these sort of problems, these foods can help. Use healthy natural cooking oils, not the refined oils, because all the refined oils are these days are all adulterated, and all are paraffin wax stained with all these paraffin. Liquid paraffin is used for making the refined oils, which none of us know. So better to go for naturally cold pressed oils of coconut oil or sesame oil or groundnut oil, whichever is your favorite oil. And in outside India, olive oil is used. So these sort of healthy natural oils can be used. Totally avoid trans fat food. Trans fatty acid means trans fatty acid is the hydrogenated oils. These are found in commercially baked foods. All these margarines and all, which they won't use butter for cheap benefits. For cost-effective manufacturing, instead of butter, they use this artificially made butter-like substance, which is called margarine. All the cookies, biscuits, cakes, French fries, onion rings, donuts, all what we buy from outside, processed food, all have margarine, which is unhealthy and should be totally avoided in normal conditions and also fever conditions. Anytime we should avoid that. Avoid coffee and other stimulants, alcohols and tobacco when you have problems, because those also will increase the vascular flow, and the stimulants which will trigger the problems. You can drink a lot of water, like 6 to 8 glasses of boiled and cold water daily. You have to drink. Exercise in normal times. At least you have to do 30 minutes walk 5 days a week. And while experiencing intermittent fever, when you have intermittent fever, doctors may suggest mostly to take rest and have some gentle stretching exercise than doing the strenuous exercise as we normally do. So when the fever is there, mild stretches. Otherwise, you have a normal walk of 30 minutes at least. Doctors may suggest to the following supplements to address the nutritional deficiencies, like multivitamin, a multivitamin tablet daily containing antioxidants, vitamins like A, C, and E, and B complex vitamins will be recommended. Trace minerals such as magnesium, calcium, and zinc may also selenium all will be helpful to repair our system and rejuvenate our damaged cells and body. So these are the recommendations what the doctor may do. Omega-3 fatty acids, which is rich in fish oils, will help to reduce the inflammation. Omega-3 fatty acids may increase the effect of blood thinning medications. If you are on blood thinning medications, then make sure you discuss with the doctor before taking the omega-3 supplements on your own, because that will be ending up to complications. Then we'll have acidophilus bacteria, the lactobacillus acidophilus, that is from the curds and buttermilk what we have, is very good for the repairing the gut bacterial situation. Probiotics for maintaining the gastrointestinal and immune health. We require these bacteria, bacterial flora growing well into the in our intestine. Patients who are severely immune compromised, they have medical reasons to bring their immune system down, for organ transplantation or something like that happened, and their immune system is suppressed. They will have to be very careful taking these out of bacteria. without the consultation of the doctor. You should not have it. Then vitamin C will also help in repairing our system because it is a very good antioxidant. We will now come to our homeopathic system of treatment of our fevers, and aconite for fevers that come for sudden and alternate with chill and heat and flushing of the face. So aconite has to be remembered like that. A patient may have anxiety, restlessness, and crave for cold drinks. Aconite is a perfect remedy for first stage of inflammatory fever. A patient feels his body aches is intolerable. The use of aconite should always be considered when fever had caused a sudden exposure to winds. So he had fever because of sudden exposures to cold wind. There is extreme chill in the body. Patient desires to be covered up always. So these sort of basic symptoms are aconite. Anyway, start of any problems, any body fever or anything, aconite works very well. And these conditions, if match, aconite will help you to come out of the problem. So next is Apis mellifica. Normally we discuss this for insect bite and all those things, but you can see how it works for fever. For fever, associates with alternative bouts of wet, sweaty and dry body heat. When the body has sweat and then suddenly it becomes dry heat, this remedy is recommended. And there will be facial flushing and sore throat and swollen tonsils. Pain may extend to the ears. Eyelids will be swollen. Exposure to cold air and cold applications will bring relief. So cold air and cold application will bring relief, and these sort of problems are there. Hot and sweaty conditions alternate. The person will be very irritable and dislike to be interfered. So like anybody going and asking how are you and all will not be entertained by this patient of apis symptoms. So he is irritable. Belladonna for sudden onset of high fever with hot red face, glassy eyes, lack of thirst, and hot body with cold hands. Body will be hot, cold hands will be cold. So this is the condition for belladonna, indication of belladonna. It is indicated for fevers of inflammatory origin. So there will be inflammation, the area will be hot. Belladonna is one of the first remedies to be thought of in cases where fever with pain in the throat. So throat pain, throat ache, sore throat, we will give belladonna, which works immediately. Which the throat will be red and inflamed also when you check with your torch and see the throat. During fever, head becomes hot, but feet will be cold. The legs and hands will be cold, body will be hot. Internally, the patient feels extremely cold, but externally, when you touch, it will be hot. So that is the condition of belladonna. Bryonia, a fever with symptoms that are aggravated by slight movement. Patient will have body aches predominantly during fever, along with chills. Body will be cold to touch, along with chills. The patient wants to lie down still without movement, but to get relief. To get relief, he has to lie down without any movement. Slight motion will worsen his condition, her condition. This is increased. There is increased thirst. Symptoms get worse from warmth. Movement, warmth and movement and touch, but feels better by lying down on the painful side. When there is a pain area, he will lie down on the painful side. So this is the condition of bryonia. Ferrum phosphoricum is a short medicine. It is given on the first stages of fever with the onset. This remedy is generally used for if the belladonna is not effective. So if belladonna fails, immediately ferrum phosphoricum helps to address the issue. Gelsemium for fever accompanied by drowsiness, weakness, lack of thirst, dizziness, and fever with a tendency to faint. Gelsemium is an excellent remedy for treatment of influenza. It can be used in early stages of typhoid fever with great exhaustion, dizziness, and patient prefer to be covered. Next medicine is Baptisia, which we always have taken the combination of arsenic album, Baptisia, and Eupatorium perf for Baptisia. This is for septic low-grade fevers. The symptom of Baptisia is low-grade fever, septic conditions of the blood like malarial poisoning, extreme prostration, great muscular soreness, chillness with rheumatic pains all over the body, and heat all over the body. It will be for typhoid-like fevers also. So this Baptisia is to be remembered. Then next medicine which is coming along with the normal medication, the trios of the fever is Epitorium perf, perfoliatum. It is for fevers with bone pain. This remedy is most effective, efficient for fevers. It's the most efficient fever remedy. This remedy provides quick relief from pain. The main indication is that fever is periodic and repeated in certain fixed intervals. Chill stage is accompanied by intense aching and bone pains. The patient shivers and shakes with agonizing pain in the eyes, head, etc. And the patient feels bruised and feels as if beaten up. Somebody has beaten him up. So it will be like that. The leading remedy is a leading remedy for dengue fevers, chikungunya, and malaria. So Epitorium perf is a wonderful medicine for these sort of fevers. Rhstox is one of the top remedy for medicines for the persons who have a fever with extreme body aches leading to restlessness, body ache and restlessness. Such patients want to remain in motion and they will not take rest. He will be keeping on moving. Rhstox is indicated for fever resulting in getting wet during rains. After rains, you get fever-like symptoms. Immediately take Rhstox and don't wait for the fever to set in. If your head is wet in rain, you can have one dose of Rhstox and you can prevent or avoid the fever conditions or infections. Fever, during fever, there is shivering all over the body. Tongue becomes dry with stretching pains in the body, along with mental and physical weakness. So these are the symptoms of Rhstox. The arsenic album, ever saving remedy for fever with marked exhaustion. Arsenic album can be brought in case of typhoid and malarial fevers. Periodicity is well marked, and body pains, weakness and restlessness, exhaustion and aggravation is during night. Accompany the complaint get worse by the slight movement and feels better after applying heat. In the heat stage, there is an inclination to uncover. When the patient is having fever, he wants to uncover as if as there is dry heat with thirst. At the end of the fever stage, there is cold and cold sweat. So this is the condition of the arsenic album. And symptoms sometimes along with fever, gastric symptoms like colic in the stomach pain, nausea, loose stools, and heaviness in the stomach may also be expressed. Pyrogenium. Pyrogenium is a remedy for septic fevers. Pyrogenium is a nosode that works as a homeopathic dynamic antiseptic for conditions like typhoid, diphtheria. Fever is due to infected wounds and chronic malaria and influenza. So some sort of infection going inside the system, and this pyrogenium works well. Coldness, chillness is seen throughout the fever, and great heat and profuse hot sweat. But sweating does not bring the temperature down. They will be sweating, but the temperature will be high. It will not bring the temperature down. While sweating, maybe the temperature is low, but immediately the temperature will rise. So pyrogenium is an infected fever, homeopathic dynamic antiseptic. Nux vomica. This remedy is indicated in influenza where the person may have high fever, violent chills, strong nausea, cramping in digestive tract, and painful cough, and constricted breathing if the flu is respiratory. The problem is because of the lungs, then there is constricted breathing. Headache usually occurs along with oversensitivity to sound. He can't tolerate sound, but can't tolerate bright light, and odors. The strong odors also will be irritating for the patient. Patient is often very irritable and feeling worse from exertion and worse from being cold or cold in any way. Whichever way he is cold, he will have irritations. Phosphorus. This remedy is indicated for a flu. When the patient is having fever with an easily flushing face, the face will be feeling flushed, feels weak and dizzy. Headache, hoarseness of the throat, cough are likely. If the problem is digestive, the stomach pain will be there. Nausea and vomiting also occurs. A patient who needs remedy often has a strong anxiety. Want others to be around, not like the other remedy. Here he wants to be around and assured and reassured, and he wants company of the people. Strong thirst with a tendency to vomit. when liquids warm up in the stomach. So he brings cold things, it will be okay. But immediately when the body temperature rises and the temperature of the liquid in the stomach rises, then he brings it out. He'll throw it up. He'll vomit it out. And this is a very strong indication for phosphorus. The last remedy which in the discussion is sulfur. This is a remedy which may be useful for flu, and it's with a long-lasting flu, or some lingering symptoms will be there often. The people have neglected to take good medical care when the initial stage of some treatment. The symptoms are either digestive or respiratory, and will often have a lot of burning or hot heat will be felt in the system. The patient may feel hot and sweaty with lower fever and reddish mucous membranes. So all the mucous membranes will be reddish. Heat aggravates the symptoms. So he would like to be in the cold area, cooled area. And the person often feels worse after taking a bath. So these are the total common remedies we have discussed about homeopathic remedies also, and the total different terminologies and different types of fevers. So I think this would have been of use to all of you. Thank you very much then. And stop. So thank you. I think it all would have benefited out of this. Any discussions we can continue.
Very nice lecture. Thank you, Anup.
Thank you.
Excellent presentation, Anup.
Thank you. Thank you. It's really, yeah, it is long, but it was good. Anyway, you can hear it again on the recordings also.
Yeah. This fever only brought me to homeopathy.
Yeah.
Our institution.
I know. Yeah.
In 85.
Oh, okay. Thank you.
For my son, actually, Dr. Kopika treated, then going on with the thing. Then when I shifted to Mylapore in 96, I joined the course of our institution.
Okay. Good to know that. Fever is common, and we now know that it is not to be brought down, to be observed only. If it is difficult only, we should bring the temperature down, because it's a defense mechanism.
Nowadays, it is very difficult to wait for a day or so, because morbidity in the body, morbidity in the universe is so worst that it may aggravate within 24 hours or 48 hours. So immediately, if one paracetamol has not helped, or one aconite or belladonna has not helped, you must rush to the hospital. Take a blood test, then take treatment, either in the homeopathy or allopathics. But you cannot ignore bypassing the blood test.
General health is poor for everybody.
Doctor advised only after 4 days blood test, sir. After 4 days of fever only, they'll ask us to go for the blood test and all.
Yeah, the reason is to allow the fever to manage by itself. That is the thing. If the fever is not managing within 4 days, then the condition is bad. That's the meaning of that.
Or by test also it will not come out. For example, typhoid and all that, it won't come out in 4 days.
Yeah. It will not become normal. Normally the fever is a temporary expression of the body, and to tell us there is something fighting going on in the system. And if you are observative and don't load too much of food and too much of proteins and oil and all when you have fever, then the system will be able to recover itself. In olden days, what they do, and the normal saying is also is, stuff your cold and starve your fever. When you have cold, you stuff your body so that your body will have enough energy to fight the cold. But you have fever, then starve the fever so that your body will recover by itself and come back to normal. I think the time is also a little over now. If there is nothing much, we can wind up.
Good, very good.
So we'll wind up, sir.
President, sir.
President, sir.
Murthy may not be there. Murthy.
Yeah, he would have gone out. Surendra, sir, can we wind up?
Wind up.
Yeah. Okay. Thank you very much, and we will all meet in the next class. Thank you all.
Meet next week.
Yeah. Thank you very much. Oh, before that,
Thank you.
happy Merry Christmas to all.
Happy New Year.
And
thank you.
and
Happy
to
New
all.
Year.
Thank you. Happy New Year. Happy New Year.
Thank you, sir. Excellent presentation, sir.
Thank you. Thank you very much. Yeah. So for Merry Christmas to all who are celebrating that, and we all will be a part of that celebration also. Thank you very much. Bye bye.